My name is Dr. Michelle Henney, and I'd like to welcome you to Rehabilitation Sports Medicine's Virtual Journal Club. For additional webinar educational opportunities, you can visit our website and register directly for the webinar or sign up for the email list to be notified of upcoming webinars. We are continuing to update our schedule, so check back often. This video will be available for review after this journal club. The information contained in the video content represents the views and opinions of the presenters and does not necessarily represent the views or opinions of Rehabilitation Sports Medicine. The mere appearance of video content on the website does not constitute an endorsement by RSM or its affiliates of such video content. The video content has been made available for informational and educational purposes only. The video content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or seen on the site. RSM hereby disclaims any and all liability for any party for any direct, indirect, implied, punitive, special, incidental, or other consequential damages arising directly or indirectly from any use of the video content, which is provided as is and without warranties. For all athletic trainers who are intending to get live CEUs from the BOC, you will receive an email 1 hour after the webinar concludes, which includes a link to the combined quiz, evaluation, and assessment. You will have up to 72 hours to complete the quiz and the evaluation. This email will come from customercare@gotowebinar.com. Please ensure that this is done to receive your statement of credit. If you don't receive the follow-up email or you have any other concerns, then contact us via our email at journalclub@relevatesportsmedicine.com. Once the statement of credit is available for download from our website, you will receive an email notification. If you have any questions during the webinar, please submit the questions and we will review questions at the conclusion of the presentation. If you cannot see the PowerPoint slides and you're accessing the webinar from your mobile phone, swipe the screen to the left or to the right and the slides will become visible. The recording will be available for review from our website tomorrow. Dr. Katie Bartolo is an international speaker on esports health and wellness. She is a board-certified sports medicine physician in the Department of Physical Medicine and Rehabilitation at the University of North Carolina, where she maintains an appointment as a clinical assistant professor. Dr. Bartolo is also a co-founder and the director of the Carolina Esports Center for Performance Health in Chapel Hill, North Carolina. And she is going to be presenting today on an intro to esports for athletic trainers.
Good morning, everyone. Thanks so much for having me. I guess we'll just jump right in. I'm going to turn off my camera just for during the presentation, just to minimize distractions. And then during Q&A, I'll turn that back on. Okay. Hopefully everything's still looking good. Okay. So today we're going to be talking about esports. This is an introduction, so this is not intended to be comprehensive, to talk about everything that could possibly be relevant to taking care of esports athletes, but instead to be a good foundation and jumping off point for those that are interested, and then you can choose to explore the topic more in depth on your own. I will include references throughout the talk as well, in case you feel interested to do a deep dive on a particular topic. So let's get started. Okay, there we go. No relevant disclosures. So I find giving talks about esports, it is a good place to start to make sure that we're all clear on the definitions. So esports is a shortened version of electronic sports. This is competitive, organized video gaming. So for those that are not familiar, you can compete in esports as an individual, you can compete on a team, this can use a console like the Nintendo Switch or PlayStation, or it can be computer based on a PC. And then inputs that you're using can be a controller, like you see down here, or it can be a keyboard and a mouse. There are multiple levels of esports competition. So we're seeing actually even earlier than high school now. I just gave a talk at the Future of Education Technology Conference, or the Future of Education, Future of Technology, anyway. So long story short, I gave a talk about this and the use of scholastic esports and we're starting to see some competitive teams build at middle school level as well. We see this at high school. Then there's the collegiate level. This esports is still not recognized by NCAA. So for that reason, it opened the door for a new organization to create a collegiate esports league. So in came NACE, the National Association of Collegiate Esports. And there are multiple schools in that. Multiple esports titles are included, lots of scholarships, which tends to surprise people. Then we've got amateur, recreational, and then the professional level as well. So what's the difference between esports and gaming? So gaming is the umbrella term for all video gaming. This will include esports and recreational gaming. Esports, though, are competitive video gaming. That's the important differentiator. So this will include multiple game titles. So it's not like esport is one thing. There are multiple esports. So esports are continuing to grow in popularity over the years, just grow and grow and grow. Last statistics I looked at, nearly half of US gamers identify as female, which is fantastic, though we are continuing to see some male predominance at higher levels of competition, though that is improving. There's an estimated 200 people in the US that play video games. And also US gamers spend about 13 hours playing video games per week. So this is all over the place. And we need to make sure that we're asking our players, even if they're traditional athletes, if they're video gaming as well, because that can potentially increase the risk of other types of injuries. Let's talk about who these esports players are. So as I mentioned previously, they're predominantly male, though we are seeing that improve in recent years. Average age is going to be, unsurprisingly, late teens to early 20s, so that college level, and then after college going on to professional as well. Wide range of daily time spent playing. There's a wide range, and there's a lot of talk about unhealthy grinding culture and how we can do that in a healthier way. That's just gaming for hours on end, just super extended, not taking breaks, not very healthy. Frequently, esports players are going over 3 hours without a standing or moving break. They're staying sedentary and seated for a prolonged period of time. And the majority of them are non-smokers, so that's good when we're looking at the general health profile. Let's talk about their physical activity levels. So not a lot of them are meeting physical activity guidelines compared to the general population. Also, similarly, we saw lower step counts than age-matched controls. This particular study looked at collegiate esports players. Players with higher rank, though, in game tended to have greater physical activity levels. So we can start to see, is there maybe a relationship between physical activity and esports performance? And kind of keep that at the back of your mind. We'll return to that in a little bit. And then 90%, greater than 90% of professional players reported moderate or high levels of physical activity. So kind of the same thing. The players that are at those highest levels are reporting higher levels of physical activity. Now, there's always that bias of this is player reported. So are they inflating the amount of physical activity they have? We don't know. That's always a risk with survey-based studies. Still something to kind of keep in mind. Let's talk a bit about body composition. So when we talk about BMI, we use BMI a lot as a measure of health. Unfortunately, though, BMI can sometimes be an inaccurate measure of health because it doesn't take into account body composition, which includes your body fat percentage, lean body mass, and bone mineral content. And these factors can impact your overall health. So it's possible to have a normal BMI while also having high body fat percentage or low lean body mass, which also includes muscle. And so why does that matter? Well, that matters because when they looked at low lean body mass, they found that that can be detrimental to health even more so than higher body fat percentage, meaning that you can be at higher risk for insulin resistance, diabetes, other metabolic syndromes, as well as musculoskeletal injuries. So this study looked at collegiate esports players and compared them to age-matched controls. And this found that the collegiate esports players had a normal BMI. However, they also were found to have higher body fat percentage and lower lean body mass, as well as lower bone mineral content. So this clues us in that these players, while seemingly looking healthier with a normal BMI, they are at increased risk, or maybe at increased risk, for certain types of health conditions, as well as musculoskeletal injuries. Oftentimes, people outside of esports tend to question the physical skill that's necessary to perform at the high level for esports and to play esports in general. So it really does take skill. It's not the same thing as using a computer for doing office-based work, or as we do when we're charting if you're a healthcare worker. So it requires a lot of visual acuity, visual motor control, fine motor movement. I like to think about esports players as fine motor athletes because it requires fast, precise, repetitive movements. Reaction time is really important. Spatial awareness, lots of repetitive movements, postural endurance as well when you're sitting for a prolonged period of time, being able to maintain your core and your upper back and all those things so that you're in a posture that is optimizing your upper extremity movements and things like that. Actions per minute, or APM. Basically, one action is each input, whether it's a mouse click or a keyboard input or pressing a button on a controller. So esports players have higher APM than computer office workers on average, and some of the maximum recorded APM in an esports player was around 500. In addition to physical skills, playing esports also requires cognitive skills. So mental endurance, if you're on a team, working with your teammates, emotional regulation is also really important, as well as executive functioning tasks. So attention, working memory, keeping track of where you are on the map, keeping track of which schools the skill is in cooldown, task switching, decision making, trying to determine which thing to do now versus later, where you are in the match, things like that is also happening while you're having to perform physical skills as well. And combining these together, when we consider that, it's not too dissimilar from traditional athletes. So let's start talking about health considerations for these players. And first, we'll start with musculoskeletal considerations. So let's talk about risk factors for musculoskeletal injuries in esports players. So we've got our fine motor athletes, right? So they're using smaller muscles that are not really designed for this type of repetitive movement unless they're trained for it. So you've got repetitive movements on small muscles plus static load. That's going to then increase the risk of physical injury. Also, sustained posture. We talked about that postural endurance. Well, if your posture is good, well, you may not have as many problems, though even if you sustain good, quote unquote, good posture for a long period of time, you still may end up with issues. But sustained aberrant posture, so essentially bad posture, can lead to things even more likely than if you have good posture. Just staying in one position at a time, the body was made to move, so that can increase risk of injury. We may not have good ergonomics. Maybe we're sitting too close to the screen. Maybe we are abducting our shoulders slightly when we're using the mouse. Maybe our cubital tunnel is pressing on the side of the table. All kinds of things could be increasing our risk of injury. Possibly body composition. We just reviewed how that low body mass and high fat percentage can potentially increase the risk of musculoskeletal injuries. Long training periods. We talked about that long range of daily esports play. And if we're on the upwards end of that of 15 hours, especially if we've got suboptimal ergonomics and sustained aberrant postures with repetitive movements using small muscle groups, we're certainly increasing our risk of musculoskeletal injury. And then there's that question of overall fitness. If we're not training the body to be able to sustain certain amounts of load, then we're also increasing our risk of injury. So some studies have looked into which types of musculoskeletal pain are most common in esports players. Top sites were number 1 was the back and number 2 was the neck. So those axial injuries potentially related to aberrant sustained postures or just sustained postures altogether. Other sites that were reported for musculoskeletal pain included the shoulder, the wrist, and the hand. We're not too surprised about that either. Close to 50% reported having MSK pain in the previous week, so that's not a small amount. And then if we look over here at the figure on the right, this talks about the number of musculoskeletal pain sites that were reported. And we can see that the vast majority of those players surveyed reported having more than one site of MSK pain. So clearly this is a problem and this needs to be addressed. Let's talk a little bit more about those sustained aberrant postures. So staying in not a good posture, bad posture, poor posture for a long period of time. Picture on the side here, it can show us, we've got that classic forward head, rounded shoulder posture that we're very familiar with. Things that this can predispose to are going to be that upper cross syndrome, intervertebral disc dysfunction, facet mediated pain, some spinal nerve root irritation or impingement, pectoralis minor syndrome or thoracic outlet syndrome, and some shoulder issues as well, such as subacromial impingement syndrome. Let's talk a little bit about the most common axial injuries that we see. So that upper cross syndrome, imbalance in key upper body muscle groups with that forward head posture and rounded shoulders. That human head is going to feel heavier when it's held away from the body in the forward position, which is going to put stress on muscles, and it will lead other muscles to tighten while other muscles become weaker. So we can treat this, right? We can treat this really well with exercise programs to target the muscle imbalance, to correct the posture and help improve pain. That said, we need to make sure that we're also addressing the core strength to help hold up the torso as well. Intervertebral disc dysfunction. Sometimes I see late teens with disc issues, and they're surprised to find out that they can have a disc issue because they're so young. The thing is that there are studies that have shown that sitting can increase the pressure on the spinal discs, and this is especially true with forward flexion. So we think about the whole, bending forward when you're lifting something can increase the risk of pressure on our spinal discs. However, when we sit too with that forward flexed posture, you can see that also puts a lot of stress on the discs as well. And in a more recent study, we found that it was actually pretty close to when you're just bending forward at the standing position. Additionally, there were studies looking at static disc overload and found that static disc overload, meaning when you're just sitting in a position with load on that disc for a long period of time, for example, sitting gaming for hours, you've got that forward flex posture in the seated position, that can actually predispose to disc herniation. And we are also really good at treating this. Core stabilization program to support the lumbar spine is something really important to do that we know can help support the discs and help prevent this. Some common peripheral pathology. This isn't going to be surprising to you all on the webinar here. So we're going to see a lot of things affecting tendons and peripheral nerves. So we can see overuse tendon pathology. We see this a lot in our traditional athletes as well. So that lateral epicondylosis, deep vein synosynovitis, which also has been nicknamed gamer's thumb. We can see intersection syndrome as well. And then those peripheral nerve compression motoneuropathies and entrapments. So cubital tunnel syndrome is one that I see quite frequently. I use ultrasound in my clinic. There's a picture over here on the right to help diagnose this and see the ulnar nerve being pinched, which you can see here. We can see carpal tunnel syndrome. It may not be directly related to their gaming. However, we see carpal tunnel syndrome in the general population, and oftentimes it can be related to sleeping position. So even if it's not directly related to their activity, it's still important for it to be a differential that we keep in mind, because it could affect their gaming, even if they're developing a condition related to something else. And then radial tunnel syndrome as well, which we know is closely related with that lateral epicondylosis diagnosis. A word about ergonomics. Can't talk about gaming and esports if we don't touch on ergonomics. So yes, it is important to try and optimize the gaming setup, you know, how your chair is positioned, how your arm is positioned, how the desk's positioned, how far the screen is from your face and from your eyes. And there are lots of guidelines on this, largely generalized from computer office work. There are some good free resources to assist with this. Again, not necessarily gaming specific or esports specific, but there's this great self-assessment checklist available online that can provide enough information to help your players get a better position. It's important, though, to emphasize that this is only part of the solution. I think too often people want an easy button solution to say, well, I bought the best gaming chair, I have this adjustable gaming table, I've done all these adjustments on my monitor positioning, I'm using a footrest, like I'm all set, I can sit here and game for hours on end, and I don't need to take breaks, I don't need to do all these other things. And the fact of the matter is that's just not true. Even perfect posture can be harmful if sustained for a long period of time. So we know that that can cause muscle strain and fatigue, and then once again can predispose to overuse injuries, as well as, you know, the things we talked about before as far as neck and back problems. So yes, it's important, but we need to make sure that we emphasize that it's not a fix-all, because it's too easy for people to just try to grab on to the easy button stuff and not need to do the work as far as strengthening and fitness. What are some barriers to care? So there's not a ton of research on this. I'd really like to see more research on this. My group has been working on some studies right now to try and get more information. So our players, our esports players, seeking medical attention? And if so, why not? So there was one study, or a couple studies that looked at this, one that really broke it down, and found that a lot of esports players are not going to get medical attention for musculoskeletal complaints. And this study here in the graphic in the screen is trying to break it down into who they went to see, if they did. And I feel like, unfortunately, the study was pretty limited with when we look at the options here that they included for players to go see. For example, I don't feel like my specialty is well included here, but bottom line here, there seems to be a gap, and we can speculate as to why there is that gap, and there's probably several reasons. That just means that I think from the side of healthcare and medical care, we probably could be doing a better job of asking, say, you know, if you're a healthcare provider in your clinic, asking your patients whether they present that information or not, to ask them, do you game? Are you an esports player? They may not present that information. Sometimes they might be worried that there will be a stigma attached to it. If we are athletic trainers and there's an esports team or teams at the university or college where we work, to go to those teams and tell those players that they're welcome to come to the training room if they have complaints, that you have the tools to help them get back to the thing that they love to do. And I think that that's an important way to try and bridge the gap. There's more work to do, but I think that's a great early step. Now that we've talked about MSK things, let's move into the non-musculoskeletal medical consideration area. So eyes, yes. So eyes are going to be something we need to consider in this population. Going back to that study earlier where we talked about the top MSK pain sites, in that study, the overall complaint by those college esports players actually was eye strain or eye fatigue. So even though we said that back was #1 for MSK complaints, it was behind eye for just overall complaints. And this makes sense. We know we're interacting with the digital screen. There's a lot of information about computer vision syndrome, also referred to as digital eye strain, lots of different terms for the same thing. This study, though, said that it was eye strain, eye fatigue. We didn't get a lot of information, though, on what that is specifically. So on the left of the side of the screen here, I've included for you all the symptoms that are included underneath the umbrella term of computer vision syndrome. So you can see there's a lot of different ways that this can present. So curious to know what symptoms predominate here. Risk factors, so as I said, we're using a digital screen for a prolonged period of time. We may not have great ergonomics. Are we sitting too close to the screen? Maybe they have an uncorrected refraction error. Maybe they already use corrective lenses. They need to be modified. Maybe they don't already use corrective lenses, but they should be. They might have an untreated ocular condition. Perhaps they've got chronic dry eye. So all of those things can play a role in contributing to computer vision syndrome symptoms. What are some tools that we have for treatment and prevention of computer vision syndrome or digital eye strain? So improve those ergonomics. We don't want to sit too close to the screen. Artificial tears can be helpful. So oftentimes when we're using digital screens, our blink rate will decrease. So the use of rewetting drops can help mitigate those symptoms. Taking regular breaks. So making sure we're not sitting there for long periods of time without a break. Forgetting that. You're noticing a theme here, right? Breaks are important. There is something called the 20-20-20 rule, where it's recommended that when you're using a digital screen, that every 20 minutes of screen use, you look at the object, you look at an object 20 feet away from you for about 20 seconds. And this allows the eyes to relax. There was a study looking at college students. This wasn't focused specifically on esports players or video gamers, that did show a decrease in computer vision syndrome symptoms with regular implementation of the 20-20-20 rule. Now, the 20-20-20 rule isn't often very applicable when we're playing esports. It's not like you can just stop in the middle of a game at 20 minutes and say, hold up, I have to do my 20-20-20 rule for my eyes, right? So we can build this in to fit gameplay better, and it can be specific to the title, but I will discuss with teams about how they can build these breaks in a way that is less disruptive to gameplay. Getting their eyes checks. If they do have a refraction error, make sure that's being corrected appropriately. And then there's the question of blue light filtering glasses. So there's been a good deal of research looking into this. I mean, they look cool. Right now, I would say still enthusiasm currently outweighs the evidence. A lot of studies have found that there's not a lot of meaningful results from using them from the standpoint of preventing digital eye strain symptoms. That said, they're not necessarily harmful. They haven't really documented a lot of adverse events. So aside from any impact of the cost, they could be used. We just want to make sure that the use of these blue light filtering glasses doesn't stop players from implementing things that we know will be helpful, like regular breaks, getting their eyes checks, and using rewetting drops, and checking their ergonomics. Let's talk about the heart and cardiovascular system. So you may be surprised to learn that there is a cardiovascular response when playing esports. This was a pretty cool study. It actually happened during a live collegiate esports tournament, and they used heart rate monitors to measure heart rate during competition, like pre-competition, during competition, and post-competition. And they did find that a physiologic stress response was elicited with heart rates comparable to that expected with moderate to vigorous physical activity, which I think is really interesting and important for us to know when we're taking care of these players. We did see that pre-competition heart rate values were elevated compared to the average resting heart rate ranges that we expect. This suggests that there's an anticipatory arousal response to esports competition. And we know that this is a well-documented phenomenon ahead of competition, for example, in traditional athletic players, athletes in traditional athletic competition. So the bottom line is we can see that the heart is getting stressed. And so we need to keep that in mind when we're taking care of these players and screening them. A word about stimulant use. So caffeine, energy drink companies are often sponsoring esports competitions. I've seen it at the collegiate level as well. And then prescription stimulants. There is health considerations of this, and there's also those fair play considerations as well with this performance enhancing substance. So we've got a lot of regulations for performance enhancing substances in the traditional sports space. We don't have as much in the esports space. While there have been some organizations that have put on competitions that have included this, I wouldn't say that it's very widespread. From a health consideration perspective, we know that stimulant use can help enhance performance, and when used correctly can be helpful. You know, a lot of people drink coffee just in their day-to-day, and it helps us with cognitive focus and attention and things like that. So, but there are also problems when it's excessively used. Like most things, when we use too much of it, it can be problematic. So there's a wide range of symptoms of excessive stimulant use that can range from very mild to minimally noticeable things to very concerning things that can certainly progress in the setting of an underlying condition. So because of the knowledge that a physiologic stress response is elicited during esports competition and recognizing the use of over-the-counter or prescription stimulants in this population, it's important for us to consider cardiac screening in esports players. We do this in our traditional athletes, so it's not a stretch to just generalize this and incorporate this with our esports players as well. For typical routine cardiac screening questions, we need to make sure that we ask about stimulant use in this population. Are they using energy drinks? Are they using coffee? Are they using prescription stimulants? Are they getting that from a provider? Are they getting that from somewhere else? How much are they taking it? We need to screen for any symptoms of excessive stimulant use, and then do our physical exam, listen to their heart, and check their blood pressure. Moving on to mental health and lifestyle considerations. So we couldn't talk about mental health in gaming if we didn't touch on the addiction gaming disorder. So that is a documented and recognized condition. This is not necessarily gaming, right? This is a separate entity when things go too far, like most things. That said, there's no evidence that video games increase the incidence of developing a mood disorder, and there's no evidence that esports players are at higher risk of developing a mood disorder than anyone else. These are common misconceptions and myths, but they come up a lot, especially in the younger age groups, from parents that are concerned about the risks of playing video games. What are some risk factors in this population? Well, poor sleep can happen, high stress environments, high stakes competitions, young age. These are not unique to esports players. They're very common for this age group, for athletes, especially performing at a high level. Recommendation, so let's ask about it. Let's ask, how are they feeling? Do our traditional screening that we do for our traditional athletes. If we need to, make sure that we are feeling comfortable to refer to a professional and that we have those resources available. Meditation and mindfulness can be really helpful. It helps with emotional regulation, which can help prevent the spiral of negative thoughts and negative self-talk. And then regular aerobic exercise. We know that exercise can be helpful with emotional regulation and mood. And so we can talk about that with our esports players, how they can help with mood, as well as the other benefits of physical exercise. A word about tilt. So tilt is an emotional reaction, usually a negative one, anger, rage, frustration, to something that happens in a game that then results in playing poorly or playing worse. This comes from poker and has now become pretty widespread used term in gaming and in esports. Usually triggered by a specific event or something that someone said or did. Then it starts to interfere with decision making. So you're getting angry, you start getting irrational, has this cascade effect of then being like, oh, this isn't going my way. And then you start continuing to let emotional regulation spiral out of control and make poor decisions, and gameplay continues to deteriorate. And it's kind of like this negative feedback loop. A word about sleep. So I'd say that usually that in general, the information about sleep here wasn't very surprising to me and hasn't been. It's what we expect to see in this population of late teens, early 20s. And it's probably similar to what we would see in our general population, which we've seen here. Sleep disturbances were similar in the general population. They're getting a little bit less sleep than we would recommend. Nearly half of participants met criteria for insomnia. Nearly half of them had sleep disturbances before competition, so they're getting nervous about competition. We know that sleep deprivation can be really harmful to performance, especially impacting cognitive functioning and reaction time. We also are crankier when we're not getting enough sleep, which can lead to impaired emotional regulation, might predispose to tilt. So sleep is super important. We know this. This is true of all of our athletes and includes our esports players. Let's talk a little bit about research that looks into esports performance. We're going to talk about 3 studies that looked at physical interventions and its impact on esports performance. So this study looked at the use of HIIT a little bit before playing. They had a counterbalance study, so they had the players do HIIT for about 15 minutes, and then they had a 20-minute kind of washout period of reading, and then played League of Legends. And then in the other arm, they had a rest period for 15 minutes. They read for 20 minutes and then played League of Legends, which is an esports title. And the study showed improved overall performance and accuracy that you can tell from the graphs on the right side of the screen here. So this does suggest the potential of improved esports performance from pre-game HIIT. This was performed more immediately, not quite immediately, but more closely related to the play. Like it wasn't like an overall like HIIT program that they were doing over a long period of time. It was looked at from, you do this about 20 minutes before you were going to play and then see how it impacts it. That said, esports performance is something that's really important to esports players. And so this could help promote regular physical activity within the esports community. And it's just helpful to know what types of things that we can use to help promote performance and improve performance. So this study then was a a jump off of that prior study, looking instead at doing HIIT, a few minutes before playing. What happens if you implement a regular HIIT activity program? And so what they did is they had a study that implemented a 6-week HIIT program. There were 83 participants. They were all first-person shooter gamers from 18 to 29 years old. They didn't specifically mention the level of competition, though. They didn't talk about the breakdown of pro players versus collegiate players versus recreational in their demographics. And so this study found that there were improved gaming skills, including reaction time, tracking, and accuracy with this implementation of a 6-week HIIT program, which is really great information. And they also noted improved sleep quality, which was a secondary outcome measure, still valuable to know and not surprising, right? We know from other studies that regular physical activity has been linked to improved sleep quality. That said, the more esports specific research we can get, the more robust the recommendation, the more you can get buy-in from the esports community. And the last study we're going to talk about was looking at seeing how a 6-minute walk break worked out for helping with esports performance. It didn't show very meaningful results for improvement in in-game performance. That said, the vast majority of the participants reported a perception that the walking break positively impact their performance. So perhaps taking that break was helping with mental aspects and mood aspects. That said, it didn't specifically help with in-game performance. So looking at the 2 prior studies, it's possible that it's just that intensity, that breaks are good and they have some benefit specifically to, like I said, those cognitive and mood aspects, but perhaps we need a higher intensity because those prior studies looked at a HIIT program to provide improvement in in-game performance as opposed to walk, which is lower intensity. So some take-home points to wrap things up. So esports players are fine motor athletes. It does require physical skill to perform at a high level in esports games. These players do need regular eye exams and eye health screening. Cardiac screening is also important. Physical exercise may improve esports performance, especially high intensity interval training. For common injuries, think about the spine, those axial injuries, tendons, and peripheral nerves. Standard mental health screening is also important in this population. Good ergonomics are a part of healthy gaming, but not the whole solution. And you can help these players. You have the tools that you need already. We're not reinventing the wheel here. We have similar injuries in areas that we commonly see in traditional athletes. We just need to be open to seeing these players, and we need to help bridge that gap to let them know that we're here and that we have the tools to help them. Thank you so much for your attention and for joining us this morning, and I'm open to take any questions.
All right, so the first question, it looks like they were looking for you to define, I guess you'd use the acronym HIIT, and they just wanted to confirm that that was high intensity interval training.
Yes, yes, that's it. That's correct.
And then there was some enthusiasm about being a Tar Heel.
That's awesome. Let me see if I get my video.
Just waiting to see if there's any other questions that pop up. Okay. Diane asks, would you repeat the reference for the statement about the BMI, specifically the low lean body mass? Oh, not hearing you.
Yeah, specifically for the literature reference.
That is the way I'm reading this.
I can go back. It was the DeFrancisco Donahue paper from 2020. Let's see. Not sure. Let's see. This is the 2019 one. Right here. So number 6 on the screen, the DeFrancisco Donahue paper here. The esports players got muscle, competitive video game players, physical activity, body fat, bone mineral content, and muscle mass in comparison to match controls. Published in the Journal of Sport and Health Science.
Okay. The next question comes from Nadine, and she is asking if you have seen any ergonomic companies sponsoring. I assume that means esports teams, but
Ergonomic companies. I am not familiar with any ergonomic companies. I've seen a lot of esports companies that make equipment trying to be more aware of ergonomics, and that what that generally means is making equipment that's adjustable ultimately, because we all have different body shapes and sizes. So one chair that's just set and not movable is not going to fit different types of body shapes and sizes. Or instead, if you have a really customizable, adjustable gaming chair, that's going to allow for better ergonomics for most people because they can modify it to their body type. I'm not sure if that directly answers your question.
yeah, and then she put just a quick clarifier. I guess it's more out of curiosity if you have seen any ergonomic companies sponsoring tournaments.
I have not.
Okay. The next question comes from Carrie. She asked, do you ever do any VOMS activities or similar to prevent eye strain?
Not at this time. We currently are working on a study to try and get a better idea of what eye strain looks like in esports players, because as I was talking about, that's a really general term. And so as a clinician, I find that unsatisfying because I want a lot more information about what that looks like. And so once we get that, we'll look more into interventions that can target those specific symptoms.
The next question comes from Steve. How long will it be until we need to see improvements in total thumb components from overuse?
Can you repeat the question?
Yeah, how long will it be until we need to see improvements in total thumb components from overuse?
So for example, like modifications to controller design, perhaps, to try and mitigate overuse thumb injuries. I think that is a great thought that comes up, that came up recently when I gave a talk to some sports medicine docs as well. And I've thought of that too. I think it would be a really great study to look into what we could do to modify controller design like we've seen with mouse design to try and mitigate overuse injuries. That said, anytime we do any of those things, there's always that risk that people are going to just lean on the easy button, right? That they're like, oh, hey, I don't have to take breaks. I don't have to do conditioning for my fine motor muscles to be able to sustain this repetitive motion and this load. I can just use this modified controller or mouse because it's going to decrease my risk of injury. And so I'd love to to see some studies on that. I wish I had more time to do all the research studies in my head, but I'm also a professor and a full-time clinician. So I don't know how long it will take. I think right now people just grind through stuff and they deal with the injury. My hope is that with all you all on this talk, that you'll go out there and you'll start educating your players, that we can help them if they have injuries, if they come to us early. They don't need to stop gaming, that there is that culture of I can get injured, I can rehab and get back to playing. And hopefully that will help drive some change. But I think right now people are just kind of existing with what they've got. I don't know exactly how long it'll take.
The next question comes from Ronald. Do you have esport athletes get a preseason EKG or ECG to have an established baseline or to catch any cardiac abnormalities?
I do not. I think that you can use your screening questions and including like family history or any symptoms to determine if that is necessary. But I would say in this case, I'm not getting baseline ECGs.
Brooklyn asks, do you think esports will evolve from stationary sitting to more movement like virtual reality or even like Wii Sports to prevent overuse issues like postural deficits?
Yeah, interesting question. So there absolutely are virtual reality sports already, and we're seeing competitions for that. And I think that we'll continue to see that area expand. I don't believe that we'll see traditional esports completely go away though, in place of VR gaming. I think that there will continue to be two different groups. I just think that traditional gaming and esports has such like a culture that's so widespread at this point that I don't see those games going away entirely to being full body VR type sports. But on the VR sport type thing, I see that expanding, and I think we're going to see a whole different set of injuries with that. Those multi-directional treadmills and people flailing about, and especially when they start using larger muscle groups and they aren't warming up and they're not training appropriately for doing like those larger movements, we're going to see a whole different injury panel than we see with traditional esports players that are more fine motor muscles and more stationary.
Okay, Alyssa notes, psychologists who specialize in technology addiction report that screens create a need for ever-increasing levels of stimulation to achieve the same dopamine rush, rendering offline activities unbearably dull by comparison, desensitization. How do we combat this with esports athletes besides recommending to take breaks?
It's a wonderful question. I will admit this is a bit outside of my scope of practice as a sports medicine physician. I am not a mental health provider, so I screen my athletes and players for certain conditions, and then I have good relationships with colleagues in the area to whom I can refer if I have concerns for other things. So I think that's a great question and an important consideration, but a bit outside of my practice and the scope of this talk.
Okay, and then Daniel, I think this is in reference to the previous ergonomic company question, but Daniel posed in the back school, CEAS1, CEAS2 are ergonomic companies and certifications. Okay, the next question comes from Whitney. Is there a burnout syndrome when it comes to esports athletes similar to traditional athletes?
Surely, it's not a different syndrome though. It's simply burnout. We as humans just get burnout. It's all the same burnout, whether you're a doctor, college student, or a soccer player, or an esports player, or a League of Legends player, you know. Burnout, I think, is just a part of our culture of continuing to trying to do more, not necessarily prioritizing self-care and all of those things that can help promote performance instead of just pushing to do more. So it's as much of a concern in our esports players as our traditional athletes and should be considered in the training room.
All right, that appears to be all the questions. That was a very robust amount of questions.
That's great. Well, thank you so much for all of the engagement and wonderful questions. I hope that you found this session enlightening. I hope you'll go out there and just spread the word about esports health and wellness. And I hope you all have a wonderful day. Thank you for having me.
Absolutely. Thank you, everybody.